Good morning. We're ready whenever you are.
Okay. Good morning, and thank you to Chairman Joyner and ZINERMAN for the opportunity to come and speak with you today. My name's Laura Schultz. I'm Executive Director of Research at the Rockefeller Institute of Government, and this is my colleague, Leigh Wedenoja. She is a Senior Policy Analyst, and we're both economists at the Rockefeller Institute of Government. The Rockefeller Institute of Government is the public policy think tank for the State University of New York. Our researchers and fellows conduct rigorous, objective, and accessible research and outreach to provide citizens and governments with reliable facts and tools to understand public problems and inform decisions. Today, we wish to share some preliminary findings from our work on COVID-19's impact on an important but often overlooked sector of New York's workforce, women without a college degree. Analysis of employment losses following the COVID-19 lockdown found women, workers of color, and those without a college degree were more likely to lose their jobs. To help these women return to work, we need to better understand the jobs that employ them. The Rockefeller Institute has conducted a preliminary analysis that focuses on the jobs that are predominantly held by women without a college degree. These jobs fall into 4 industries: healthcare, childcare, food service, and office support. These women work in the service sector and the care economy. Job titles include teacher assistants, child care workers, nursing and health aides, service workers, and office support staff. Before the pandemic, almost 1 in 4 New York's workers were employed in female-dominated lower education jobs. These jobs earn between $30,000 to $45,000 a year, far below the $68,000 a year state average. Before COVID-19, 30% of all women employed in New York held one of these jobs. Nearly half of employed women of color were employed in one of these jobs. 42% of working mothers and 51% of working mothers of color held one of these jobs. And more than half, about 53%, of working mothers who are unpartnered work in one of these jobs. In order to develop policy solutions, we must better understand the nature of this work, the women who hold these jobs, and the barriers they face when participating in the workforce. My colleague Leigh will outline some research that we need to do to better understand the challenges.
Great. So one of the primary issues is that these female-dominated lower education jobs, often thought of as female-dominated blue-collar jobs, are grouped in ways that make it difficult to pull them apart from each other, something that's been highlighted by COVID. So all nursing aides, home health aides, and psychiatric aides are one job category within the federal definitions, both at the census and at the Bureau of Labor Statistics. This is compared to male-dominated blue-collar jobs, which have, 19 different types of construction workers? So as a result, it is hard to distinguish between the jobs particularly the pay disparities between these different types of health working jobs. These are 88% of all health support workers, and COVID has made it clearer as some of these workers have been in high demand, particularly those kind of health aides that work in ICUs, that work in hospitals, that work in public health. But those who work in things like dental practices or work in people's homes were no longer in demand during COVID as family members were staying home, and we have no way to distinguish that in the existing statistics. Half of working mothers of color are also part of this workforce, and the pay is far below the state averages. Households supported exclusively by jobs in this sector have far less economic security, and more research is needed into the role that this employment plays in New York households and can help policymakers address equity issues, particularly multi-generational consequences of lower paid work. And finally, just the importance of understanding the importance of childcare. These women are generally people who need childcare to both support their jobs. They also make up the majority of the childcare workforce. Parents are demanding additional childcare, but many of the childcare workers who have been laid off have found other employment or have children of their own and can't return to work yet. Thank you.
Thank you. Okay, I guess to follow up on your last point, you mentioned that many women need additional childcare, but childcare workers have been laid off during this time. So what can be done with that issue, while also addressing the barriers to help women return back to work?
I think we need to better understand what happened to the women who were working in childcare. We need to know what jobs that they taken other jobs in other sectors now that are relatively better paid than childcare work. We need to find out the barriers that they're facing when returning to work. Are they going and working in private situations? So I think we need to do a better understanding of why these women aren't taking the childcare positions that they once held. And if we understand that, we can better recommend policy solutions to those problems.
And what's the best way to do outreach so that we can collect that data so that we have a better perspective on this issue?
I think standard data sources that keep track of the jobs that people have in surveys, either through the U.S. Census Bureau runs one, BLS runs one, but particularly because childcare is a little different, it often requires licensing, that New York State does license childcare providers, both commercial ones and in-home. So there is likely a good source of data there with our licenses and, are they fully staffed? You need different licenses for different numbers of workers. You need a license and a background check to be a childcare worker. Understanding whether or not, what the changes are in that industry through licensing could work really well.
So it's also my understanding that salary transparency is also a big issue. Do you think that this is an issue for the care industry in terms of making this information available? Would it be able to help retain workers, or would it basically help encourage workers to find employment elsewhere?
I think salary transparency is important. People need full information when making decisions about their careers and where they want to work. But I am also concerned that the transparency will reveal relatively low wages compared to other sectors of the economy, and it may encourage those workers to find employment elsewhere.
To add, I think there's also quite a bit of heterogeneity within the salaries in these jobs, and I think that is something that, while we talk about these jobs as being no college jobs, they're generally more like no bachelor's degree jobs. So a lot of these women and the men who are in the workforce as well do have some form of training, whether it's an associate's degree or a certificate, and being told that the average wage is, X for a health aide doesn't tell you that being a highly specialized health aide is going to pay very differently than being a home health aide that's non-unionized and at a sort of contracting company. And we just don't, especially with the federal data and the way that jobs are classified, we cannot provide workers with that information because we don't know the answer.
Well, I want to thank you both for your testimony. This is great data, so I have a couple of questions for you. As I look at the data that you provided on page 2, I almost wish that Commissioner Breeden was a part of this panel and could sit next to you. Back in my workforce development days, I can tell you when I look at these occupations, I'm not surprised because basically these were the jobs that welfare to work programs tracked people into, right? So it was a office assistant or some sort of administrative work, childcare, some human services work, or maintenance. And so the trend continues. And so if she was here, I certainly would ask her, have we moved past that and really opened up the world of work, as we say in our literature, to those who are looking to be retrained or people who don't have, as you mentioned, a college degree. Her talk about apprenticeship programs and other methods to get people training is important, but if we're still tracking people into the same sort of work, they're not going to have the ability to earn a higher wage. Certainly the pandemic, and there is a question in here, but I feel like I have to say this. Certainly the pandemic has illustrated how important all of these jobs are, right? There are so many people, I mean, our population is aging by 2030. There's going to be more people over 55 than between 0 and 18 for the first time in history. So nursing care and child care and kinship care are going to be very, very important. As you look at these trends, and especially with regard to the wage, what are some of the things that you would recommend? Because these are highly skilled jobs when you think about the care that people need. Other people cannot go to work because they have no one to take care for their children or for the elderly. What are some of the recommendations that you would make in terms of salary increases, notwithstanding the BA, for people who are doing this critical work, especially during the pandemic?
I think, again, more data will give us a better understanding of the different wages paid to different people in elder care, and can maybe, for example, the home health care aides who are working in elder care or nursing aides, by better understanding how their careers progress over 10 or 15 years versus just lumping them all together in one pot. If we can better understand how their careers advance, if we can better understand what type of training and experiences they get, and better demonstrate that there are career paths within these positions, I think that will really help professionalize some of this work and create higher paying jobs.
So
Absolutely.
there is a career pathway. I mean, it's home health aide, there's
Yes.
LPN, and then you can go into skilled nursing if that's what you want to do. The question is that, I mean, the problem is that is not revealed to most people,
Right.
and the work is so work intensive. If we're not talking about remote access to learning and such, when do they have the opportunity to go back to school or even to a training program in order to benefit from that?
I think that's a really important thing to bring up. And I know with Commissioner Reardon, there was a lot of discussion about traditional blue collar jobs, these, trade-based jobs, and the way that people move through trades. No one who moves through, you're not expected, if you're moving through a plumbing trade, right? You start as an apprentice and you eventually, hopefully, own your own firm or run something. At no point are you expected to go back and get a bachelor's degree in the middle. If you want to do that nursing track where you start as a home health aide, in order to be an RN, you almost need a bachelor's degree these days. More than 50% of RNs have a BA now. And there's been this professionalization in skilled nursing, LPNs, RNs, nurse practitioners, just like there's been a professionalization in teaching. So K-12 teachers, if you stay in the career for 10 years, you basically need a master's degree now, not just a BA. We haven't seen that same kind of professionalization in these lower education versions of those jobs, in these childcare workers, certain kinds of preschool workers, and in these nursing aides. We also can't really track well who is actually moving from a nursing aide to an RN. Is this a common pathway, or are people kind of getting stuck? And you really need long-term data that follows the same people. There is some of this at the federal level. It's generally built through tax records, which can be sort of very hard to do, right? There's a lot of privacy and all sorts of records, and we just really don't know how common those pathways are, how successful they are, and whether or not, colleges can fill in with those part-time education programs as they go through.
So having said that, what do you think the state could do to assist you with that? I mean, certainly you talked about accessing licenses. Certainly when people are signing up for some sort of trade, a lot of times it is with a state-run program or a state school. What can we do to help you get access to this data so that we can start really studying this particular trend? Because this work is not going anywhere. This is the future of work.
Right. I think that what we need is connections, better access to data so that we understand what is going on. I think we need to go into that data with a lens of looking at these women in the workforce. We need access to the organizations that represent these women so that we can have both, to match it with the data, qualitative analysis, talking to them, understanding what the challenges are, what the barriers are, to help inform that quantitative analysis as well.
healthcare worker organizations and oversight within the state probably know a lot more about particularly the disparities in wages among these different kinds of healthcare support workers, as well as there are disparities in pay among different kind of childcare workers. You're going to make something very different working as a childcare worker for a public school district than you are working in a home-based system, and connecting with those organizations, connecting with licensing, being able to understand that career trajectory rather than a moment in time through linked records is the only way we're really going to understand what these pathways look like.
And nannies and
Exactly.
as
Yep.
well. Okay.
Which is a whole other type of tax filing.
Absolutely.
Hi, thank you for this study, which quantifies many things which we knew anecdotally. My question is, when you say share of job loss is 10 months, that is through when?
That was the first 10 months of the pandemic, so that would have been March through January.
Okay, so now we've had about half the workforce go back. So where are we now?
The most recent data analysis that I have seen, I think, was February or March. The people who have been the slowest to return to the workforce are the women of color. I believe that their labor force participation rates are half of what are
And-
lagging men and white
Right.
women.
It's also important to remember that women, particularly women of color, had lower labor force participation rates to begin with. Almost 90% of men with a child under 5 are in the workforce. It's less than 60% of women with a child under 5. These are huge disparities in how we started.
Well,
And so then you saw that particularly when women lost their jobs, they were less likely to come back. The data's not up to the moment at the moment, so always a problem with labor data.
I know, I don't have much time, so I got to ask little questions.
Go
and
for
if I
it.
have pointed answers that'd be helpful. Which of the jobs that are seeing the least? My guess would be that you would have waiters and waitresses are the least amount of people where you have most of the problems. Where are people not returning to the workforce, the women that you're referring to here?
Unfortunately, we don't have the data yet to see that.
We need the data, because I
Yeah.
can't, it's very hard to act on this. It's
Yeah.
well-intentioned, but it's kind of empty. One thing for sure is that the hospitals are not yet living up to the spirit of the law, even though it's not totally in effect, concerning having minimum staffing requirements. That's a problem. That's a problem with nurses' aides. And the big problem with personal care aides for elderly and also group home workers, which I've been getting complaints about. My feeling is that what we have to do as a state, if we don't put money into that, we're going to spend 100 times more putting the same people into nursing homes. So I think we have to invest in the personal care aides and the group home workers, or we're just going to be penny wise and pound foolish. I think, so let me ask you this. Let me say this. If we don't know where the problems are and where people are returning the least, we really can't target our remedies. So,
Exactly.
Yes.
I mean, it's not, I mean, it's easy to say, and it is true that child care is very important. And hopefully, we're going to build back better soon and have that addressed. But I just hope that in the future, you target and find out where we have the problem of people not returning, and so that we can then focus our remedies. Thank you.
Okay, so New York State has put a tremendous amount of money into universal pre-K, which I think will help moving forward and getting women back to work. Just a question, because since July of 2021 and $970 million that the state has invested into universal pre-K and in the 2022 budget, and added 105 million. Have you started tracking as to what effect that is having on getting women back to work?
So pre-K teachers are actually classified differently than childcare workers. They're their own classifications, so they actually tend to be both more higher educated and more highly paid. We have not started tracking the effect of the increased pre-K on women returning to work. Part of the issue is, while pre-K is universally available, there are still a number of parents that are keeping their kids at home because kids that age cannot be vaccinated yet. So we have not started tracking that, but that's definitely on our radar. It ideally should help.
Yeah, because if we're investing this much money into universal pre-K, it'd be nice to know who's taking advantage of it and who isn't, and if they aren't, why. So I'd be curious to see the data on that. In my district, Brookhaven National Lab they have their own daycare at the facility. Do you think that it would be helpful for the state to invest money into manufacturing facilities having daycare on site, so that the parents can check in on their children and be able to go to work and know that they have a place where their child can go if they're unable to find childcare at home? So have you done any studies on that as to reaching out to companies such as large manufacturers throughout the state to see what the hurdles are of bringing women into the manufacturing industry? Because it seems to be there's a very large turnover of men in the manufacturing industry, and as the Labor Commissioner indicated before, there are a lot of jobs that are available to women that men are taking up those jobs, and they are high-paying jobs. So have you looked into that as to manufacturing facilities larger that women could probably get into those fields? And it really is on-site training, so.
I think those are really important questions, and this study to date has really focused on more of the women who have gone unstudied in the service economies and the healthcare and care economies. The corollary to this would be, why aren't women in manufacturing or construction, the other types of jobs that we aren't looking at here? And I think those are good questions to ask when we explore that part of it.
And I think keeping the childcare question entirely, always looking at it broadly, one manufacturing center's in-house childcare is not going to make a large difference in the scale of the problem with childcare, in part because they're going to have just as much trouble hiring qualified childcare workers as everyone else, and those are the women, generally the women who are in our study. So it's all this feedback loop. They can't get those jobs because no one wants the jobs that are needed for them to get the manufacturing jobs. Someone has to staff the childcare center.
Right, but if you were looking at a regional childcare center, say at a large manufacturing facility that can employ up to 1,000 people, I think that's something to be looking at.
Yep,
As to the need
absolutely.
of the larger manufacturers throughout the state that would bring women in if they had an opportunity and were incentivized to provide childcare.
Absolutely, and the future work in the study will be to explore programs like that have been successful elsewhere that can be a blueprint for developing other policy moving forward.
Thank you.
Okay, we've also been acknowledged by members, we've been joined by Member Fall and Member Vanel. And ZINERMAN, if you have any other follow-up questions?
I wanted to ask, do you have a sense of how many employers are open to their children, to workers bringing their children to work? Do we have a sense of what the availability is for those who are in the caregiving field, but also are mothers themselves, their ability to bring their children to work in order to take advantage of programs such as the one that was just mentioned by my colleague?
Our preliminary analysis to date hasn't really looked at that, but what we're hoping to do once we have the data and can really look at some of the stories is to dive deeper and take a look at child care centers that are having success in employing people and finding perhaps that it is programs that allow their workers to bring their children to work with them. So I think that's, again, an example of once we've had a chance to look at the data, we can find the policy solutions and the best practices that work.
This also brings up another issue in the data that we're constantly confronted with, which is generally the surveys that survey employees are not the same surveys that survey employers. So we don't always know, we can't always match the employees and their experience with the employers and their policies. There are a few federal surveys that sort of link them, but this is something that would have to be approached with more, some qualitative work as well as quantitative work to really talk to workers and talk to large employers.
And then finally, are you getting all of the data that you need from the Department of Labor? Are there other things that you would need from them? Our assistance with identifying other trends, or just an answer to some of the questions that were posed here today?
I think one of our next steps is to reach out to the Department of Labor, and now that we have the preliminary numbers and analysis, to justify a further in-depth study to help take advantage of their resources and offer our expertise and assistance in really doing a comprehensive study of these jobs.
I look forward to reading the report. Thank you.
Yes, I also want to thank you for diving deep into this whole issue and adding color to the conversation in terms of more details as to what the care industry actually looks like and what type of positions are in those categories. And then I guess I wanted to ask, do you see any barriers to pursuing secondary education? Is it, lack of access? Maybe we need more online courses that's affordable, and also just helping with this whole new world that we're living in right now in terms of more flexible options. Do you think that would also be something that could be helpful?
I think that would be really helpful, and I think that the workforce development providers who will be testifying have more experience on the ground with the barriers that these women are facing, and so we look forward to also working with them in the future to get a better understanding of their perspective and what they have learned from the women that they work with, so that then we can look at the data and see what the real consequences of those barriers are.
Within the healthcare workforce specifically, there are not enough publicly funded RN programs. There are not enough nursing associate's degrees and nursing bachelor's degree programs to keep up with demand, especially for workers who need to attend part-time because they are already working. I think that's been sort of well established in the literature that we just do not have the capacity for all of the nurses that need to be trained.
Any other questions? Okay, great. Well, thank you so much for your testimony.
Thank you.